We are missing Dr. James Zetta, and we're missing Ivanka. So Cleo and Dawn.
She said she was logging in, so she should be logging in. Is hopefully.
Thank you. Good evening. My name is Krista Allison, and welcome to part 2 of Know the Facts, a conversation on COVID-19, sponsored by Stark County Alumni Chapter, Delta Sigma Theta Sorority Incorporated. We're so happy that you're able to join us for part 2 of our conversation. If you remember, last month we took you on a journey to talk about the 3 levels or chapters of COVID-19 and knowing the facts. The first was registration process. The second was the vaccination 101, and the call to action was our third element. Tonight, we're going to be continuing our conversation to discuss 3 new chapters as it relates to COVID 19. The first is understanding our past, the second, what we can do now, and the third, building a healthy future. Now, we want to make sure we remind you that this is a question and answer process and as well as a virtual chat. So feel free to connect with us through our Facebook Live, or if you've logged in through our Zoom, you can submit your questions through the chat there as well. We also want to offer a disclaimer. Keep in mind that the information being shared this evening is an overview and a conversation regarding COVID-19, the vaccination process, the registration process, etc. For medical information, please contact your doctor or medical healthcare provider. So with that, again, we want to thank you and again welcome you to part 2 of our conversation on behalf of the Stark County Alumni Chapter of Delta Sigma Theta Sorority Incorporated. To kick us off, I'd like to invite to the conversation my fellow sister, Kelly Scott. Kelly is a member of the Stark County Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and she is the Director of Diversity and Engagement at Tricucu at Cincinnati. So, Kelly, I'd like to talk with you a little bit about our conversations that we've been having with respect to COVID-19, the pandemic, and the vaccination process. You expressed the importance of understanding our past, as I recall when we were talking in the past about this. And you also had stated that it was important not only for our chapter, but for many others to understand our history as well. So, can you start us off and just share with us some of your thoughts with respect to not only understanding our past, but the importance of having this conversation in our community?
Yes, thank you, Krista, and welcome to everyone. We are excited about having this conversation. I do practice diversity, equity, and inclusion and specialize in healthcare. And on many occasions, I would hear information about African Americans in various communities who were actually not getting vaccinated and really not even having all the information necessary to make the right decision. And it's quite frustrating because, as we know, there are racial health disparities all over our country, and we suffer the most And then when COVID-19 came around, we're suffering the most from that as well. So, having a conversation with my sisters, we talked about it and we're like, what can we do to address these concerns? But what's happening? We've got to listen. We need to learn from our community, and what can we do to address it? And we know that there are several, and we're going to today with our special guest that we have today, they're going to help us understand, is it a trust issue? Is it because we do not trust the health system? Could it be access? We've heard of those having difficulty registering or not even having the internet in order to register. Or could it be that they're just waiting, right? Life happens, they're living their lives, they're working, taking care of their families, and maybe they just haven't taken the time to actually get the shot. So I think with today, and I want to encourage everyone that's participating in this call today, is think of our future. Think of this bright future that's right around the corner. And we have so much to look forward to: hugging our families, celebrations, birthdays, graduations, shopping. I know if you're like me, I miss shopping. So we've got a bright future ahead of us. And I hope today's conversation will help you not just to survive, but learn to thrive. When you have good health, and we talk about these underlying conditions, when you have good health, you can thrive in life, not just survive. So I'm hoping that this conversation today will help us to be able to do that. Be smart, be informed, and then make your decisions and talk with your family members and loved ones so that you can thrive in life.
Kelly, thank you so much for setting us up and really creating the premise for this conversation and the premise as to why we are doing the part 2 to our conversation today. So we want to thank you so much for that. Now, I do have a small favor, Kelly. Do you mind? Could you stay with us for a little bit as we talk through this evening?
Absolutely.
And then I also have another small request. Can you set us up for a clip that I think you can describe the clip for us before I play it, which kind of sets up the conversation that we're going to be having this evening and the premise behind it, and just give some behind the scenes as to who produced the clip and why. Can you do that for us?
Absolutely. So, and Lisa Johnson, you correct me if I'm wrong with any of this, but I think that Altman Health Foundation and Cleveland Clinic Mercy Hospital, along with Ponder Systems and Ron Ponder, and I also think the health department and several local organizations came together and they put together a video so that we can provide information that's specific to our community. And what we did is we tried to take some clips from some of the guest speakers that we thought would be most that would coincide or align with our conversation today. And one of them that I was really impressed with, and I'm looking forward to meeting him, is he's an advanced practice nurse, Deshaun, and I believe it's Kimwese. And he is with Cleveland Clinic Mercy Hospital. And what he did during his clip, he actually talked about a lot. But the piece that we're going to show you is where he does talk about the fact that there may be some trust issues and what we can do to internally deal with that, and externally, what research we need to do and who's involved behind the scenes with this vaccine. So with that being said, if we can start this clip.
Thank you so much, Kelly.
Question. We're all, again, going through something that's new and different and disruptive to our ways of life. I don't think anybody has experienced something like this in their lifetime unless you're over 100 years old, and you have a faint recognition or a faint memory of the Spanish flu back in 1918. But the question is usually centered around, is it ethical? Should I get it? I have mistrust of the healthcare system. I have mistrust of the government. And to that point, I would say there's valid reasoning for that, because there has been unethical, terrible mistreatment of Black and Brown communities with regard to healthcare experimentation and things like that. However, that being said, this coronavirus that we're facing now is unlike anything we've ever seen in our lifetime. And it's affecting Black and Latinx communities at rates that are higher than white communities, than many other communities. And because of that fact, both in hospitalizations, people being hospitalized from COVID-19, that's higher in Black communities, and Latino Latinx communities. And deaths, COVID-19 is about 4 to 5 times higher in deaths than in majority white communities. And so because of that reason, it's important for us to get the vaccine, for minority communities to get the vaccine, and for majority communities for the protection of the common good.
African American.
Okay. Thank you, Kelly, again for setting us up with that clip.
Absolutely.
And now we're going to move into the conversation around understanding our past. And so with that, as we move forward with this, I'd like to now introduce a few additional conversationalists that will be joining us for the conversation this evening. The first is Yavanka Hall. Yavanka Hall is the Executive Director at the Northeast Ohio Black Health Coalition. Yavanka received a Master's of Public Administration from Texas Southern University and a Bachelor of Arts from Notre Dame College. The 1974 murder of her mother, Yvonne Boston Hall, dramatically changed her life. Her childhood promise to use her life to help others has led to the creation of cutting-edge programs and impacted thousands of people's lives. She's a published author, lending her story, The Making of a Public Health Emergency, to the book Not Far From Me, Stories of Opiates. She's a mother, grandmother, and activist, deeply impassioned and involved in social justice activities locally and nationally. Her strength and tenacity will save many children from the lifelong impact of lead poisoning. She's a member of numerous organizations locally and nationally. She's a nationally recognized congressional award-winning health disparities expert. She speaks all over the country about effectively engaging the African American community, the art of community engagement. She's an activist, leader, influencer, speaker, researcher, and philanthropist. Please welcome Yavanka to our conversation. Yavanka, please.
Hi, how are you all? Thank you.
Thank you so much for joining us this evening. And thank you just for sharing your passion with us and your expertise. When we have the conversations around understanding our past, it's important for us to set that framework. And so that's why we wanted to play that initial clip. But can you provide us with your expertise, being the nationally recognized and congressional award-winning health expert, so that we can understand and have perspectives around our history in order for us to move forward?
Yes. So, one of the things that we have to understand is that we, as Africans and African Americans now, we have experienced 246 years enslaved, 99 years under Jim Crow, and all of the atrocities that Jim Crow brought us. But when we look at these two periods of time, they account for about 87% of our experience. So our time since then, so since the Civil Rights Act, it's about 13% of our experience here. And so even since then, when we look at how we've been treated as a people in our community, we still haven't been treated fairly. And so it's important for us to understand around historical experimentation, and also around that versus vaccine hesitancy, because they're two very separate and distinct things that we kind of merge because of our past experience. So we merge this vaccine hesitancy with experimentation, and so the experimentation that took place with Black and Brown communities all over the United States. So the experimentation was not with white communities. So when we talk about the vaccination is something that all communities need in order for us to move forward. So, so we have to also talk about, some of the things that happen with experimentation, because we always talk about the Tuskegee experiment, but we also have the gynecological experiments with Marion Sims. And they always want to say it started before it started in 1845. But he didn't start practicing his so-called version of medicine in 1845. So we know that there were things that took place way before 1845 and way before Marion Sims. We also had the radiation experiment that they did on Native Americans, well, particularly Black Native Americans, and Henrietta Lacks. Her cancer studies and the fact that her cells have provided billions of dollars to institutes all over the world, and that her family was compensated zero for and given very little information about what was done to her. Um, and then they also did a radiation study on African American children. And so these are just some of the ones that we know that are listed. And a lead paint study, which happened in the 60s. Talk about the longevity of these studies and how they have impacted our community. And one of the people who talked about the studies on Black folks all the time, was Hamer. Fannie Lou Hamer coined the phrase, the term Mississippi appendectomy, because she was sterilized. She wanted children, her and her husband wanted children, and she went in to have a mass removed, and she had a forced sterilization. And she found out that a number of women in her small little town in Mississippi were also forced, not just women, girls too, that they were young and they were forced, received these forced appendectomies. Um, and so we have to understand the historical trauma around this, but we also have to understand where cultural proficiency comes in. So for African Americans, the whole cultural proficiency piece, and for us, that is understanding the nuances of community. That's the proficiency piece, because we get a lot of people talk about cultural competency. You know, a lot of these systems are like, we're culturally competent, we're culturally competent. And I'm like, no, I want you to be culturally proficient. I want you to understand the nuances of me, like all the things that I bring into the table when I introduce my Blackness into the room. And so for African Americans, we have two periods in history that account for a change in our health status. One of the periods was between 1865 and 1872, and that was during Reconstruction. That was when the Freedmen's Bureau was set up. So the Freedmen's Bureau actually set up Black medical schools. And for those of you who graduated from HBCUs that have medical centers, you know, that's when a lot of those things were set up. Those things look like us, talk like us, and walk like us. Hospitals, the schools, the hospitals, and clinics were established in the South to change the health status of formerly enslaved folks, because you know what had originally happened is those things saved us from extinction. We were expected to walk off those plantations and die, and guess what happened? We didn't die, we multiplied. So there has been this whole thing about why are Black people still here for a long time. But that has nothing to do with them. That's a whole nother church level. And so the other historical trauma, when we talk about our status, happened during the Civil Rights Movement. And so that time between 1965 and 1975 brought us the Civil Rights Act. And with the Civil Rights Act, it brought us desegregation in hospitals, Medicaid and Medicare, and it also brought us community and neighborhood health centers. Those health centers brought with them people who look like us. Understand, I keep going back to people that look like us, people that look like us and are trained to talk to us and walk with us and live in the neighborhoods with us. That's cultural proficiency, making sure that you have people in the room who understand the nuances of the people who ain't in the room all the time. And so since 1980, we have, as African Americans, seen a big decline in our health status. So our health status has declined since 1980. And as a matter of fact, in 2016, between 2016 and now, African Americans have lost 2.7 years of life. So our life expectancy now, instead of 75 years, is now 72 years. So I want my 3 years back. And so when we talk about, you know, who do people trust and how they trust, we have been plagued with persistent race-based disparities that have existed for centuries. And those things have impacted our health compared to our white counterparts and the population as a whole. And those things have led to our mistrust of these systems. And so we have to talk about racism and how it plays a very big part in our institutions, our intellectual, our policies, and our personal levels. And we have to understand, as the Slave Health Deficit Report stated in 2002, that racism is deeply ingrained in the fabric of the United States. And so remember, we talked about this experience, that this is that time between enslavement and emancipation and the civil rights movement was 87% of our time here. So just think of all the stories that your ancestors have told you over the years. You know, I've been blessed to know not only my great grandmother, but my great great grandmother. Okay. And so the stories that they told me were enough to make folks in my family shun medical establishments. Like, I'm not going to the doctor, and that's because those are the experiences that have been with us for a long time. And so when we talk about the Jewish community and we talk about the impact of the Holocaust and that it is now interwoven into their DNA, we also have to understand that the Holocaust of slavery is deeply woven into the DNA of Black folks. And so even though I don't feel the whips and chains, I feel the whips and chains. I feel the whips and chains of my ancestors. And um, so the vaccine hesitancy for us is our delay in the acceptance or the refusal of vaccines, despite available vaccine services. It's complex, and it's content specific, and it varies across place, time, and vaccines. And it does, because we've seen other things that we weren't hesitant about. Um, we weren't hesitant about diabetes. We weren't hesitant about hypertension medicines. We're not hesitant about some of those other things that allow us to live. But this, it was just something about the time and the place of this that allowed us to have more hesitancy. And also for vaccine hesitancy, it is also influenced by complacency, convenience, which I know you all are talking about. And confidence. How confident are we in the people that serve us, particularly when they don't look like us? And what this means to us is, for African Americans, we have to change. For communities that want to engage with us, they have to change the way they engage with African American communities. They have to understand that relationships take time, that trust is developed over time, and that for white people who are working with Black folks, you can't change who you are, but you can understand who your audience is. And social workers have talked about that a long time. And and so we also must eliminate persistent disparities that are in this vaccine rollout. We have to take it to the streets. We have to make it easy and accessible for people to get. And we have to understand that this isn't the Northeast Ohio Black Health Coalition or Delta Sigma Theta or the Urban League. This is all of us coming together to address the issues that are going on in our community. And so part of that is we're talking about experimentation on one end. This is not what's happening now. This is vaccine hesitancy. And so we have confused those terms as a community because of all of the other things that come into the room with us. And so we have to let people understand that experimentation took place in minority groups. So you might have an experiment with all Black people, you might have it with all Hispanic people, you might have it with Native American people, but it wasn't with white people. And so when we talk about this vaccine, it's everybody. And so we want everybody to understand that this is something that is safe, it is timely, it is effective, and it is going to save your life. The vaccine doesn't keep you from getting the virus, but what it can do is make it less likely that you'll have all of the ill effects that you get from the virus. So what I can tell you before I be quiet, because I'm sure you over there like, girl, shut up. But what I can tell you is that 47 days ago, my life changed. There was a person who came from out of town to visit my grandmother, who is now 90 years old, and they left the virus with her. And in my pursuit to save my grandmother, save my uncle, my cousin, her boyfriend, I got the virus. And so now I have long COVID. This is 47 days out, and I'm still having the effects of COVID. My grandmother still has some brain fog. But if I'm able, I'm going to make sure that I take the vaccine. My grandmother's going to take the vaccine also. That was something that was very important to her before she got the virus. But I think that as a community, we don't talk enough about people going into other folks' homes, or people all of a sudden they got, this big bump in government money. So now they got $1,400 plus. And now they think they can go on vacations and travel and stop and drop into your house. And they did not take the vaccine, or you haven't taken the vaccine. And so we really, really have to talk to our young people about the risk factors that go into this right now, and encourage them to take the vaccination. Thank you.
Ivanka, this was awesome. Thank you very much for sharing this with us. I really want to drill down, and Kelly, I would like you to, if you could be part of this aspect of our conversation, because you talked about the 3 C's. you talked about cultural proficiency, and I have heard the term cultural competence. That is the new term. I'm using the air quotes, the new term that we're hearing organizations use. But I love that term about being culturally proficient as well. But I'd like to hit back on those 3 C's. And then Kelly, I want to pick up with you because Kelly's been talking about this, and just she's been in my ear as well as many others saying this is why we need to really talk about this. And there have been others within our sorority as well who've been really focused on this to say we need to understand our past, and we can't just glaze over it to think, oh, it doesn't matter, because it really does matter. And it is, as you said, it's part of our DNA. It was traumatic, and we need to honor, we need to recognize, but we also need to know, even in honoring it, how do we move forward? And we do so in a way where people have an understanding as to why it's important to get the vaccination. So I just want to touch a little bit on that, and I want to hit back on that 3 C's because I want everybody to get those 3 C's. Tell us those 3 C's again, Ivanka.
So what do we talk about? Cultural competency, cultural proficiency.
And you said confidence, convenience as to why people get, yes.
And proficiency. So the cultural competency is, it's a term that they use in human resources, where they're making sure that people are getting the services that they need from from the door to the back of the door to out the door. And so a lot of these organizations take these cultural competency classes and they're like, oh, I'm culturally competent. But cultural competency just means you understand how systems work. That's all cultural competency is understanding that your system is doing what it's supposed to do. And so for those who work in diversity, you know exactly what I'm talking about. That is making sure that your system is doing exactly what it's supposed to do. But cultural proficiency is making sure that you understand the people who are using those systems. And so regardless of whether it's a Black person or a white person or it's a Hispanic person, understanding their situation and what brings them into the system, into those systems. Like, so as part of my bio, you talked about my mom being murdered in 1974. So she had 4 children. So, when you got 4 children and you don't have a car, and you know that when you wake them up in the morning, somebody's not going to know where a shoe is, somebody can't find their socks, and so getting on a bus, you may be late. And so when you get to a hospital system, it says, if you're more than 15 minutes late, we're not going to see you. But cultural proficiency says, I understand your circumstances, and we're going to make sure that we get you seen, because we want to make sure that we fix everything that we can so the next month is not worse. So if something's going on with you today, and that's what brought you here, we're not going to say, oh, well, next month, you're going to come back next month. We're going to reschedule your appointment. And I think that the other thing too, for us, convenience is where these vaccination clinics are taking place at. Having mass clinics at places that Black folks don't normally go don't help Black folks. Because these are places that we don't go to in the first place. And so you have to take it. That would be another C, taking it to the community. And so taking it to the community is you take it to where they are. And that means we know where our seniors are. So all we have to do is follow the money, ask the Social Security Administration where the addresses are, and go and test them. Go and not only test them, go and give them their vaccinations, because a lot of seniors want the vaccination. But remember that we have told them for a whole year, don't go out of your house, stay safe in place, make sure that you're wearing a mask, do telehealth visits. And now we're like, oh, we need you to go to the stadium downtown for an appointment. And they're like, no, they told me to stay at home. And if your grandmother like my grandmother's like, no, they told me, this is what they told me. I don't care what they told you. They told me to stay at home. And so we have to understand that we got these nuances that are in our family, and that our seniors watch the news all day. All day. My grandmother, when you go to her house, she don't watch nothing but CNN. Nothing. She can tell you everything that CNN said from the start of the day to the end of the day. And so those things are about those proficiencies. Understanding that people were following your advice, particularly seniors. When they said stay in, when they said don't do this, our seniors did it. They stayed in, they wore a mask when they needed to. And so now they're like, I'm safe. And now they're telling me to come out. And if I come out, I'm going to die. And I don't want to die. And so we have to really understand that is real. And that is trauma. That is trauma that they knew before me. My grandmother's 90 years old. She knows a different level of trauma than the 53-year-old me. So, so we have to understand that, but we also have to understand uninformed. And those are our young people who think that this is, oh, well, this is easy. It doesn't impact me, because they don't think that their actions impact anybody else in the house, because they think that they can kind of like float over it, float
Mm,
around it. And so when I talk about young people, I'm talking about young people. So going between that ages of like 13 years old, going to about 40. Those
mhm,
are what I consider young people. They're at the bar, they're at the club. These kids are playing together in the streets, and so they're still putting themselves at risk. And so part of that message is taking it to the community and letting them know, look, this is the risk to your grandmother. This
mm,
is the risk to your mother. I've lost 35 friends to COVID. They
mm,
graduated in '86. They either graduated from John F. Kennedy or John Marshall High School. 35. 35. And the only reason I'm here is because I was going to die 45 days ago. And I took an experimental drug, the same drug that Donald Trump and Ben Carson and Christie and Rudy Giuliani took. Otherwise, I would not be here.
mm.
Um, and so we have to understand that our community isn't as informed as we are, and that's why we need to give them all that we got. If this was our time to give them all we got, and to take it to the street, as the song says, this is our time to change the dynamics in our community and help people to live.
Oh, wow. Thank you so much for sharing that with us and reiterating the importance of why it's not just for us, but it's for our young people as well. So I love the fact that you've taken this over generations to explain it. Kelly, I want to make sure that I jump back over to you as well, because you have been instrumental in bringing this platform to the forefront for us to have this conversation today. So I'll turn that over to you to add some additional feedback and words of wisdom.
Oh, thank you. And Yvanka Hall, you have a I don't think anyone could have shared the information any better. I just want to add two things based upon my experience in healthcare is when you talk about, we've actually used the word culturally effective, cultural proficiency, kind of like the same thing, is what we're finding in health systems is that, you hear all about this diversity training, unconscious bias, et cetera. And training and education is two different things. So, and I know I have educators on this, on this call, but health systems, they're really learning and hopefully learning the fact that you cannot put our clinicians into a class for 2 or 3 hours and then expect change behavior when they're interacting with patients. It has to be ongoing development. So that is really a huge in the healthcare industry. Is that's the only way they're going to be culturally effective or proficient. And the other thing is, I just want to encourage the fact that, as Yvanka was mentioning, that clinicians, I mean, research has shown, and they keep doing more and more research, and it keeps saying the same thing. Black folks have better outcomes. They recover quicker when they are interacting with clinicians that look like them. And that is because of the communication and the understanding and the cultural proficiency that that clinician is displaying with that patient. So we do not have enough. I've worked in hospitals from Texas to Ohio, and we can't recruit what's not out there. And if we have the access to African American nurses and researchers, pharmacists and doctors, there's competition. So you have, depending on the region that you're in, they know they have a choice on where they can go. And the numbers just aren't out there. So those that are in education, we do all that you can to collaborate and have partnerships with the local health systems and universities so that we can create this pipeline of African American nurses and physicians, et cetera, so that we're not having the same conversation 10 years from now.
Thank you so much, Kelly. And thank you for bringing that all together for us as well. Thank you, Yvanka. Thank you, Kelly. Please, can you both stay around with us for a little bit longer?
Sure.
Okay, wonderful, because we're going to bring everyone back together as a part of this conversation. Next up, and again, we're moving into levels, everyone. So I want to make sure there aren't any questions before we go into our next level. So we'll check our chat, we'll check our Facebook. If there are any questions, we'll take those now. Okay, this is when I wait patiently and I pause. So I don't see any questions jumping up in the chat, but again, we want to remind our listeners that the information being shared is an overview. For medical information, please contact your doctor or medical healthcare provider. So up next, we want to have some conversations with you regarding what can we do now? What can we do now? Up next, as a part of this conversation, just to help us figure out what we can do now, we'd like to bring to the conversation Jim Adams. Jim Adams is the current health commissioner for the City of Canton Health Department. He has been at Canton City Public Health since 1985, joining the department as the Director of Environmental Health and becoming the Health Commissioner in 2018. Jim oversees a department of 70 professional and dedicated staff that are focused on improving health and health equity. And so we're going to bring Jim on, and then right after Jim, I'm going to be introducing another individual, and I'm just going to go ahead and introduce her now as well. And this is Dr. Jamesetta Lewis, and she's a physician at the Cleveland Clinic Mercy Hospital. Dr. Jamesetta Lewis is a native of Canton, Ohio. She graduated from Glen Oak High School and attended college at National Louis University in Evanston, Illinois, where she received a Bachelor of Arts in Radiation Therapy. After working at the University of Illinois in Chicago for 5 years as a radiation therapist, she decided to pursue a career as a medical doctor. She gained admission into medical school at Ohio University College of Osteopathic Medicine in Athens, Ohio. Following medical school, she completed her residency in anesthesia at Western Pennsylvania Hospital, Allegheny General Health System, followed by a fellowship in interventional pain management at Western Pennsylvania Hospital in Pittsburgh, Pennsylvania. She's now employed as a board-certified anesthesiologist and interventional pain management specialist at Cleveland Clinic Mercy Hospital in Canton, Ohio. So please welcome to our next part of our conversation, which is what we can do now, Dr. Lewis and Jim Adams. Thank you both for joining our conversation. And as you both begin to kind of get set up, one of the things I'd like to start off with you, Jim, on is what are we currently doing now within Stark County, within the city of Canton by way of the vaccination process? Can you please give us an update with respect to that?
Sure, and thanks for the opportunity to be here this evening. It's interesting conversation to listen to, and it highlights some of the things that we've long known and gives us opportunities to build relationships so that we can do better in the future. I'll start off by saying, COVID did not cause disparities. These disparities have existed because of the things that Ivanka has outlined previously, and it only highlights those disparities that are already there. And so I've long said that COVID is very exquisite at exploiting any kind of weaknesses in our social structure. And so we know that people of color are disproportionately affected by poverty and by other factors, and COVID was very good at exploiting that. And it's our challenge is to try to understand that, not just at a system level, as you've talked about, but at a relationship level, so that we can build on those relationships to help increase our vaccination programs. What we're doing briefly in the county, you may or may not know, folks from Stark County, we have 4 health departments in Stark County. So that presents some unique challenges, but also some opportunities. In the city of Canton, we're largely an urban health district. And so I think we have a better understanding, at least, of some of the challenges that affect our urban population that you may not get if you were just a county health department or something like that. And so we try to, deeply understand, what's going on within our community and look at ways that we can address those needs. One of the things early on in the vaccination campaign that was pointed out is we need to make sure that we thought carefully about equity. And we were building upon our successes that we found in our infant mortality reduction efforts. And I think some people here have been part of that from the beginning. And one of those things is we took a very deep look at data to try to understand what was going on in the community and look at systems and things that would help with that process. And so those relationships that we have built over time, working on infant mortality, I think has really served us well as we started to think about how we're going to move forward a vaccination campaign that's respectful of the way that our community is structured. So, our equity outreach program, I think, first of all, for me at least, the foundation of it is building honest and long-lasting relationships. Government systems tend to come into a community, do their thing, and then leave when they think the work is done. And this is an opportunity for us as a public health system to form stronger relationships with the community that last for long, long periods of time. So that when the next pandemic comes, when the next health crisis comes, we have those relationships to fall back on, and we can work with each other to solve these problems rather than us doing something for you, which tends to kind of happen. We have tried to look for community outreach and volunteers into trying to identify influences in the community, particularly the African American community, that can help talk about vaccine, talk about the reasons for vaccination, talk about vaccine hesitancy, talk about those issues that were brought up by Ivanka concerning things like the Tuskegee experiments and things that happened historically, and how we can recognize that they existed and move forward into the future. And so we have done that. We have also tried to take a good look at data so that we can look at our performance and make sure that we are actually addressing those needs in the community. And I can share just a little bit of that with you now. We have had 5 fairly large clinic events in the city of Canton, starting on February 25th at the Civic Center. And we have specifically set aside appointments for what we call equity opportunities. And we've worked with the Urban League, we've worked with the Pastors Association, and we've worked with other groups so that they could directly schedule into those clinics and not have to worry about the technology of getting on a waiting list, of navigating a waiting list, and those kinds of things. We recognize that not everybody has equal access to technology, like I'm assuming we do, since we're all here on a Zoom meeting. But there's many people, particularly our older population, that really struggle with that. So we wanted to make sure that we had those opportunities for equity into those clinics. So at the Civic Center on the 25th, we had an African American participation in that clinic of 22.3%. We had another clinic at the Southeast Community Center in Canton, which is in a historically Black community. Our African American rate in that clinic was 30%. We had another Civic Center clinic on the 9th, and our African American participation rate was 18.5%. And again, just on the 19th, we had another Civic Center event, and our African American participation rate in that one was 12%. Just to give you some perspective, I looked at some Ohio figures, and overall in Ohio, the African American participation rate is about 11.6% in vaccination. And in Stark County, the overall African American participation rate is about 9.3%. So it's really kind of all over the place. But I do believe that our equity efforts in our community, in Canton at least, are having a positive effect, and getting people of color to be able to come to our clinics. I'll mention a little bit about having clinics located in the neighborhoods. There's a duality in the way the vaccine has been rolled out in this country. One is we have to deliver vaccine to the community in a very fast manner. So if I get, let's say, 1,000 doses of vaccine, the expectation is that I use that vaccine within just a few days. So that, for us, strategy-wise, means a large clinic in a large public setting. And so that it's difficult to put a large clinic in an area that does not have large facilities. And so our strategy for that was then, instead of not being able to put the clinic in the neighborhood, we at least put people in the neighborhood that were able to help people either get registered on our pre-registration list, or directly book appointments into our clinic. And so while we could not bring the clinic to the neighborhood, we could at least bring the appointments to the neighborhood. And then if there were issues around transportation or getting to that particular site in Canton, we worked that out. But I think that we have a very good start on our equity program with vaccination. Obviously, there's still a lot more to do, and a lot more opportunities to do that. And we're looking forward to that. It's been a very nice journey. It's been very challenging, but it's been very, very, very good.
Okay. All right.
And I'll pause there and move on. And I'm happy to meet you, Dr. Lewis. I saw your video. I thought that whole production was very, very nice, and I'm glad to meet you.
Great, nice to meet you too. Thank you for allowing me to participate in this panel as well. I'm listening to Ivanka, I'm listening to Jim and all the other participants, and we had a chance to do a podcast about 2 or 3 weeks ago at Altman, and with Lisa, who's at Altman Hospital, and then Ron Ponder, who's a well-known radio talk show host in the area. And many of these statistics that Jim had mentioned with the participation rate of African Americans in the vaccine alone is still low. It's disheartening, but I'm not discouraged by that. This is just the beginning. And like Ivanka had mentioned, there's so many different barriers and factors that play into why there is such a low participation rate in vaccinations in general. Historically, there's always been a low participation rate of Blacks in general for vaccines. I had mentioned before when I did the podcast that even though Blacks we know are disproportionately affected by the virus, we're 1.4 times more likely to die. When you look at the amount of participation of Blacks in the vaccine trials, it was less than 10%. And listening to the numbers that Jim just has given me even speaks even more truth to the fact that the low participation of Blacks in vaccines is still present even as it was with the trials for Pfizer and Moderna, and I'm sure Johnson & Johnson's numbers are exactly the same. So we have a long ways to go, but this is a big part of the solution is having the discussion. One of the interesting things that I'm noticing with patients who are coming into the office are talking to us about and asking us as questions. As healthcare providers, we've known for a long time the amount of disparities that have existed in the healthcare system. And when people are coming into the office, there is vaccine hesitancy, but we're also recognizing that accessibility is also one of the biggest factors that are hindering people from getting their vaccines. Many of my patients don't have access to smartphones. They don't have internet access. They don't know what phone numbers to reach out to. There was a beautiful article in the repository this morning about the number that you can call and access to get information about where to go to get your vaccine. So I think this is just the beginning. Accessibility is little by little getting there. The hesitancy, I think, will gradually go away once the accessibility becomes more available. And I think that's when we'll be able to make a significant impact on lowering the rate of COVID in the African American community as a whole.
Mm-hmm. Dr. Lewis, it's interesting because I'm comparing with what Jim talked as and we're at and you talk about the hesitancy. Do you think that with time that hesitancy, we can get over that hurdle of that hesitancy?
Yes, I think one of the biggest factors when patients come into the office is the amount of disinformation that they are receiving on the internet about the virus and the vaccine. It is so critical to get accurate information to people at this point in time. This is a perfect example of what we are currently doing. When patients come into the office, we tell them you must go to the CDC, which is the Centers for Disease Control and Prevention, go to the Ohio Department of Health, go to the Public Health Department for Stark County. This is where you can get the most accurate, updated information. I know Ivanka had mentioned before that her grandmother watches CNN all day long. And I have a lot of my patients that do that because they come into the office and then ask us questions about what they're hearing on the news. And once again, I redirect them to the sources that we use for evidence-based medicine. And this is what we're getting from our scientific leaders and researchers every day, because this information, it's dynamic, it's fluid, it's changing daily and weekly. So we're trying to update our patients as quickly as we can.
Mm-hmm. Well, and the thing is as you're updating people, and thank you so much for all you do, as well as Jim, what you're doing. As we're updating people, it's just a lot of information. And so how do we help people sift through all of that? Because again, as Ivanka pointed out, for over almost a year, we were told to do one thing. And now we're saying, now we need you to come out and do this. And I remember, I think it was around March 16th, was when everything started to close down and everyone just kind of stood at pause and said, what do we do now? We're
Right.
locked up in our houses. And so now we're trying to shift the mindset. We also have the past that folks are still trying to overcome as well. So there's a lot of little or many or big hurdles that are happening here. So as you're talking with us today, how do we help people overcome some of these hurdles? How do we help them step over this to get to where they need to get to, so that we can get that vaccination out there and we can get the information out there to people in a way that they can understand?
Sure, absolutely. I think one of the biggest hurdles is making sure that people are getting access to a primary health provider. I can't tell you how many patients come into my office who have never, ever seen a primary care doctor for an annual checkup, whether it's to check up for blood pressure, blood work, even your routine OB-GYN exams for women and general pap smears. If you're able to get established with a primary healthcare provider, that will then help you with your overall healthcare choices and decisions down the road. And I honestly believe that is where the largest barrier and gap exists in the African American community. We know statistically there are more African Americans who don't have primary care providers compared to other people who are non-Hispanic people in this country. And that's where that has to begin first, getting a primary health care provider to begin your healthcare journey.
Okay, so I'm taking that as step one: get a primary care healthcare provider, so that as you have questions, you can reach out, you can contact them, and they can help you decipher and just navigate this terrain, because it does change, as you said. You're right. And then Jim, as you talked about the clinics that are being open, and that there's an equity percentage as well that's being offered. Are there other methods that are happening currently that you're taking to get more clinics open, to create a larger percentage of that equity set aside for communities of color?
As far as more clinics, it really depends upon the amount of vaccines available in the community. I mean, that's really the bottom line. You know, I think there's two options. One is more providers. As more providers become available to provide vaccination, I think that's a good thing in the community. You should remember the health department is not the only provider of vaccine in our community. Every week, between 3,000 to 4,000 additional doses are received by our area pharmacies and the two hospitals and our community health centers, and they also provide vaccinations in the community. But certainly the health department plays a key role, because we're able to stand up these larger clinics and be able to get several thousand doses of vaccine out within a week. I think to open up more opportunities, particularly for African Americans, we would look for more volunteers from the African American community in our clinic operations. And so, you know, we're working closely with, you know, the sorority group and with other groups to make sure that we have staffing at our clinics that are reflective of the way that our community looks. And I think that's very important to do. It's just very important. So we look for volunteers. We run 30 to 40 volunteers at every one of our clinics. And I think the more diverse that we have, are able to have in our volunteer corps, the better it is for the community overall. In particular, we would look for volunteers that are medically credentialed. I think it's very important that the persons that are actually delivering the vaccine to an arm are reflective of the community that we are serving.
That was actually going to be my next question. If one wants to become a volunteer, what do they need to do, and what are their qualifications?
Sure. So the first thing is you have to sign up on a website called Ohio Responds, and that is a state website of Volunteer Corps, and that we pull from that list. So you would sign up for that as a volunteer on Ohio Responds. If you have an interest in helping the city health department, you can email us or call us. I see Cleo's on the phone. She's been actively recruiting. She has a mile-long list of yellow sticky notes everywhere she goes, and she challenges people to respond. But you know, if we find that you are interested in helping us, we can get in touch with you. The first thing we do is make sure that you are registered on the Ohio Responds website. If you're responding to actually provide vaccinations, there's a little bit of training that you would do about administering the pandemic vaccination that you have to complete before you work in our clinic. But then after that, we would welcome you and hope that you would come one, more, or several times.
Okay, So Ohio Responds, and actually I had a question about that too. So Ohio Responds, so just go into ohioresponds.com and okay, perfect.
Yep.
So that's part of that. And then once you're on that list, from what I'm understanding, then you'll go from that list and then pick those individuals, correct?
Correct.
Okay. All right. So that's perfect. That's perfect. And then I think we have a couple of other questions that I just want to pose to you as well. In terms of staffing, are you in terms of staffing as a part of this process, do you have diverse staffing? Are you hiring diverse staff with respect to the vaccination process in the clinics?
The answer to that is yes. We have reached out to a staffing agency that the state is assisting us with. And the most recent nurse that we were able to onboard as part of that is African American. We have another nurse that is starting. I don't know her racial background, but we are looking to try to make that workforce as diverse as possible. As I'm sure that most of you know, that in the healthcare and in the health department, it's a very white organization, and it has historically been that way. And so, we're trying very hard to change that, but it's a tough go. It's not easy, and it's not easy to recruit people. Our rates of pay are typically very low. I think a Black nurse would probably be a highly sought after commodity and could really command a pretty high salary that we can't match in most cases. And so it just makes it, those are just the challenges that are out there.
Okay, I got a couple more questions. I just want to make sure that I pose them to both of you. One is, how can our chapters, the Stark County Alumni Chapter of Delta Sigma Theta Sorority Incorporated, how can we continue to partner with the City Health Department and local health centers and systems, to help establish and plan to be intentional about hiring African Americans, PCPs? How can we do that? And how can we be intentional again about making that collaboration happen?
Well, I think one of your goals I saw on your logo is scholarship and education. So I think it really starts quite young, and I think it's getting people interested at a young age, high school or earlier, that this is a great career to pursue, and to encourage that, get the training early on, help people select that as a career path, so that we can start to build that, that pool of talented people that we can now hire into.
And then I'm going to switch over just really quickly over to Dr. Lewis. When we talk about primary care positions and trying to really make that population more diverse, representing communities of color, what recommendations do you have? What are some things that need to be considered, and how can our chapter help to support that as well?
Wow, that is such a difficult question, because we know that there's such a vast underrepresentation of minorities in general in all fields of medicine. One thing, when I decided to pursue a career in medicine, a lot of the colleges and universities, and like Jim was saying, this starts very young at the beginning, whether it's in high school, in college. At the high school level, Mercy Hospital has a program where they have high school students participate, and I think it's maybe a day or a couple of days where they come into the hospital and they're exposed to different healthcare fields. They can follow a physician, they can follow a nurse practitioner, they can follow a physician assistant, they can follow a lab technician, just to get them exposed initially to the healthcare environment. And I know those are programs that I know the hospitals usually partner with other organizations such as yours that can work with other communities, and especially high school areas where you have a larger representation of minorities versus, other schools like we have here in Stark County, where there's that much of that representation, not much of that combination of minorities in general in the school systems. But that would be a good way to start, is starting at high school levels, making sure that high schools that have a large representation of minorities are included in those programs so that they can get exposure to the healthcare fields at a young age. And even going to the college level, like I said, when I was applying to medical school, I was exposed to something called the Summer Scholars Program at Ohio University. This was a program specifically for minority students. You would participate in the summertime. They would expose you to pre-medical school courses. If you were able to obtain a GPA of 3.5 and above, it automatically guaranteed you a interview for medical school.
Wow.
And a lot of people don't know that these opportunities exist unless you actually research these medical schools that you want to apply to throughout the country.
Mm.
So there
So-
are programs out there that exist.
Can
So
I
that's- oh.
add something to that?
Yes, go ahead.
So it has to start before fourth grade.
Yes.
So we have to, so in order for us to actually make an inroads around African American students, we have to do it in pre-K, we have to do it in kindergarten, first grade, because in fourth grade, we've lost them. In fourth grade, we start losing our African American males, and right now, girls also. And so if you introduce them to medical summer camps, we can produce those in the African American community. We got enough space.
Right.
We got
Yes.
enough churches. Introduce them to those types of things, so they can understand the terminology. Because the disadvantage for Black students is that white kids, if your father was like, if you want to be a doctor, usually it's somebody else in your family that was a doctor. So either your
Right.
mom or your dad or your uncle or somebody else. And so for Black children, we don't have that, where we're looking at this and saying, we got this whole line of doctors. If you got a preacher, you got a PK's kid that that later on, sooner or later, he's going to be a preacher. So in order for us to build doctors, in order for us to make doctors, we got to start building them. That means we start building them young, because we know that they know science. We know that they love it when they're young. And so we can get their minds where they are open and ready and willing, and stop shoving tests down their throat, and actually make it about learning outside of this. Our science classes, when I was coming up, they made rockets. I mean, so a bunch of the kids that went to high school with me are doctors, lawyers. We all went to high school together. We graduated from a regular community high school. But the thing about it is, we started young.
Right.
We started early. And so you can't wait until people are gone, because once they're in fourth grade, they're disengaged. Remember, that's when we're determining whether jails will be built. So we know that there's something in the sauce around fourth grade where they're going, we need to determine how many jails. So we need to make them have how many spaces are going to be open for medical school and nursing school in fourth grade, and stop that cradle to prison pipeline that we see, because that's what's going to make the next pandemic different, because then we're going to have the radiologists and all of the nursing staff and the doctors and all the other folks that we need in our community to talk to folks, to talk to their moms and their grandmothers and their aunts, and get them to go out and take a vaccine.
So it's great that you say that, because that is part of the conversation. As an educator, I remember us talking about when kids come to kindergarten, already talking to them about, what is your interest? What do you like to do? And starting and priming that pump early. So you're so on point with respect to saying, how do we start early? There are a lot of different questions coming here in the chat. And so I want to make sure that I get some of those as well. And one of the questions that came, actually, this is for you, Jim, and this is really related to, how is the health department, or all the health departments, how are you communicating with the African American community? Because right now we know that some people read the paper, some people don't. A lot of people are looking at social media. So how is the communication and the word getting out about the vaccination clinics and what's going on?
Yeah, I don't think we're doing a lot of special targeting into the way African Americans might get key information, which is something we need to work on. I think a lot of the conversation we're having right now is personal relationships that we already have going in the community. And I would personally want to thank people like Cleo for really spearheading that conversation with her contacts. And like I said before, we had a relationship. We do have a relationship with the Urban League. Diane Robinson helps by directly scheduling people into our clinic and doing some outreach. So, it's very personal outreach at this point, but we've not done much with mass communication. But lots of opportunities to do better.
So I think that what we're gearing up now, and there's some other comments in the chat, is that we're gearing up for this call to action. When we had this conversation last month, we talked about specifically a call to action, what we can do, not only as a community, what we can do as a sorority, but what we can do overall as a people coming together to really help to get the word out about the vaccination. And so there's some comments in the chat regarding creating a mass vaccination clinic maybe over the weekend and folks volunteering for that. So if that's something that you're interested in doing, please let us know, because we'll be working with the health department to try to line that up as well. And so there are going to be several opportunities, and that's something that I know that as I'm looking at the chat, that the Stark County Alumni Chapter will be looking into. And so look for information as it comes that way. Now, I want to make sure we got all the questions in the chat. Kelly, do you see anything that's coming through that we need to tackle in the chat or anywhere else before we go to the next part of our topic?
No, I think we're good. I'm reading a lot of energy. Everybody's ready to get to work, Jim. Dr.
You know-
Jake Better, what can we do in Cleveland? Medical Center. Lisa,
Right.
we're headed to Altman.
Yes. So it looks like, Kelly, everybody, we got people hyped up. We got people hyped up. This is good. This is what we wanted to do, by the way. We wanted to get this word out so that we could get those volunteers. And again, we can create some energy around this. Up next, now this is the last part of our conversation, and this is getting good. This is getting really good. I want to make sure that we hit this last part of our conversation, and this is all focused on building a happy and a healthy future. Now, we've already hit two areas this evening: understanding our past, what we can do now, and now we're on this third aspect that we want to go into. And so it's important that we talk about this piece, because when we're building this healthy future and building a happy future, this is also part of our call to action, which is what we've been talking about anyway. Kelly, I think they caught on to our trick here, that this was building them up for a call to action. So with that, I want to make sure I introduce two additional people that are going to really round this out for us. And the first here is Dawn Pullen, and many of you may know Dawn. She was part of our first conversation as well. But Dawn is a member of the Stark County Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and she is also a mental health counselor, BSN, MAED, CDCA, LPC. So she's going to be joining this aspect of our conversation. And so we want to welcome her here to this conversation as well. And then in addition to Dawn, I want to make sure that we also, because you've heard her name come up a couple times today, so we want to make sure that we mention her as well. And she's been waiting patiently for us, is Lisa Johnson. And Lisa is joining us here as well. And I want to just do a quick introduction about Lisa. Lisa is an RN, BSN, CDP, a certified diversity professional, and she's always had a heart to serve others. She has worked for 17 years with her current employer, and she serves as the president of the Stark County Human Resource Association, president of the Stark County Black Nurses Association, and chair of the Stark County Minority Health Coalition. Lisa is the originator and co-owner of Lead by Example, LLC, Equity, Inclusion, Diversity, creating a more inclusive reality for generations to come. She's a proud member of the Divine Nine, Sigma Gamma Rho, and serves on the bylaws and social justice committees. So without further ado, I want to bring both of them up here for a part of our conversation. And as a part of this, both Dawn and Lisa, this is all about building this healthy and happy future. So with that, and there's some questions there, Dr. Lewis, if you stay on with us a little bit longer, I'm going to link back to you on this, but I want to turn it over to Dawn and to Lisa to begin talking about that based on everything that we've heard. So Dawn, I'll turn it over to you, and then Lisa, I'll swing over to you next. Dawn?
Me now.
No, hi.
Okay. Hi, everybody. My name is Dawn Pullen, and I'm a member of Delta Sigma Theta Sorority Incorporated, actively engaged in the Stark County Alumni Chapter. And I am so glad to be here today to talk about how do we move forward and how do we really make it happen for our community. Number one is that we need to address the disparities in our community in a more effective manner, which we've all seen today, and Mr. Adams has definitely agreed upon that. And how what the call to action is going to do is to help us to align and put things in place that will better serve our community and better serve the people of our community, African American community, in a more effective manner. we have worked with, and we have plenty of volunteers. And as a member of the Northeast Ohio Health Coalition for 5 years, and now as I work there as the Behavioral and Addiction Special Director. I have come to see the disparities take a toll on our community in more ways than one. And so today, our goal is to make sure that we get the word out, but not only get the word out, but have some action behind the things that we talk about. We've talked for years, for 400 years, we've talked about the disparities in our community, and we've talked about how we're going to do different things differently. But the action today that I'm calling Stark County and other counties is to put things in place that will better service our Black and Brown people. We want to live, we want our families to live and survive and thrive in 2021 and there further. And so with that being said, one of the other things that we also need to talk about is how COVID-19 and the disparities in our communities have affected mental health for African American people, and how those things are not being covered as well and doing well in our community. We know that African American males are currently taking their lives at a faster rate than they have in the past, and it is becoming alarming in our community. Part of this can all be tied back to the disparities, racism, and COVID-19 bringing those things to light. So we have to start with making sure that we're servicing our community on a greater level and dealing with the disparities. But the other part is we also have to deal with the minds and health of our people. So if we're not dealing with the health, we have to deal with the mind. And one part of that is to making sure that we have access to those services that are needed for Black and Brown people to deal with their mental health. We have an increase in stress and anxiety in African American community due to a lot of us being frontline workers, a lot of us being frontline workers and being exposed at greater levels to COVID than our counterparts. And this is definitely affecting not having money, being laid off, and losing our jobs due to COVID and the disparities that are in our community. And Jim, I know you talked about diversifying your staff. I've been born and raised in Ohio. There are plenty of African American people in Kansas who have the degrees and ability to take those jobs that you're offering. My question would be, who are you joining with to do recruitment for those jobs that look like us, that can help you identify some people in our community that would be more than happy to work and have a good job with decent pay and health benefits, more than $8 an hour. So I want to encourage you to connect with some resources for African American organizations in the community that can help you fill those positions in a better manner. Because until we get people that look like us, we're going to continue to have the problem that we have in Stark County with diversifying our staff and diversifying those and helping the people that need it the most, which are the disadvantaged. So with that being said, the call to action is do something that's going to change and make change, not only for yourself, but those people who are suffering at a greater level than you. With that being said, I'm going to turn it over to Lisa, and then I'll come back.
Thank you so much, Dawn. Thank you so much for sharing that information and also for your passion around this issue. Lisa, you're up next. And we know that as a part of this work and what you do daily, we just want to thank you for your efforts as well. And we want to thank everyone who's joining this call for your efforts, those that are presenters as well. But Lisa, what can you share with our audience today with respect to how we can look at building a healthy and a happy future based on the conversation that we've had this evening?
Absolutely. And thank you again, Krista, and for everyone joining on the call today. I think Yavanka stole the words right out of my mouth, that we, in order to create an optimistic future, we have to start early. High school, junior high school, way too late. I'm talking preschool. My granddaughter, I went to the costume store because she wanted to be a surgeon. So they were doing, and this was just a few weeks ago, they were doing this costume and who do you want to be in the future? And so her mom is a crafty person. So she sewed on her name, on her emblem on her coat, Dr. Kennedy Williamson, surgeon. So instilling this in our children very, very young and having optimism, and we have to keep talking about it. It's just not enough to talk about it one time, right? We have to talk about it every single day, whether in the classroom, in the home, in our social spaces, encouraging our young children that look like us, our Black and brown children. And we know that our country is still only going to become more and more brown. I just heard on the news the other day the influx of those individuals coming over from Guatemala. Okay, so we know that we're going to need healthcare professionals to take care of us that look like us. I'm proud to say another optimistic event that is taking place is Dr. Dale, who is doing the Black Men in White Coats. And I know I've sent that out to a number of my colleagues, and he and his team members are going out in the streets doing a call to action for Black men to think about becoming physicians. And he clearly stated in his trailer and in that documentary that if we don't have more Black and brown individuals at the bedside caring for us, we're going to continue to die. That's impactful, and that is truthful as well. And Yavanka, you spoke about the cultural competency of what we, in this space of diversity and inclusion, and many others, on this call are aware of, but it's about cultural awareness. And you're right, it's about being cultural proficient. And that also does not start when you're in medical school. It starts early. It starts in preschool. It starts all the way through your high school years and beyond. That's the only way we're going to make a change, because let's face it, 7% of the population in America is made up of Black women. So there's not enough of us to go around currently, right? So we know that we're pulling from everywhere, every source, and we're fighting for the same great talent. So building awareness in our allies, our colleagues that look like us, that want to be helpful, is vital and is crucial and is so important. Another topic of optimism that I see in building our future is that we probably, and many of us don't even know, that Ohio has 5 Black Nurses Association chapters, and it's going to be 6, thanks to Mrs. Kelly Scott's mom, Miss Ella Scott, who was the creator and inventor of the Canton Black Nurses Association, along with Dimitri Miles and many others. But we have revitalized that chapter because we know the detriment. So it's not up to us to wait on someone else to do the work. While we're alive and we have breath in our bodies, we have to do the work. So I can go on and on forever about this topic because it's a true passion of mine. I just want to say that, I know Krista, you and I, we quote Maya Angelou a lot, but we know that if you know better, that you have to do better. But if you see and you hear something, then it's up to you to step in, because these social injustices will continue to happen over and over again unless we step up and we do something. And lastly, I want to say, I know that our history of the Tuskegee and many other events, like Mrs. Harriet Washington talks about in her book, the apartheid of Black Americans, or the African Americans, and our history of being the root of many, many experiments in this country. We've got to stop, I think, using that as a crutch and get out and educate ourselves about what's important for us and our health, and not use that as a reason not to go and find a healthcare practitioner.
Yeah, thank you so much, Lisa. I was saying, when you were talking about the quote that we always piggyback on, I was like, amen, my sister, because you're so right. And the aspect that you just brought up that is so important is this notion of crutch. And sometimes we can use crutches and we continue to use them and we don't need them anymore. And it's time, I think what I heard you say, it's time for us to throw those down and to start really educating ourselves and to get that primary care physician so that we can become knowledgeable. And so there's so many nuggets of wisdom in here from everyone that has been talking today. And so I want to make sure that I'm checking the chat. Kelly, I'm checking the chat here, but I want to make sure I go back to all of you for some final comments that you can give for folks, just to give them hope based on not just what you said, but what you see as a visionary in terms of moving forward and how we can move forward as a people, as a community, so that we can not only overcome this particular vaccine, but what we see coming in front of us, which is by way of educating our young people, encouraging more of our young people to go into the medical and healthcare professions. So those words of encouragement, I'm setting you up already. I'm setting you up. So those are the words of encouragement I'm looking for as we kind of round this out for everyone. So I'm going to start first. And I'm just telling you, Don and Kelly, I'm going to save you two for last. Okay. So I'm going to start first with Ivanka. I'm going to start with you, and then I'm going to move down to Dr. Lewis, and then to Lisa. I'll move over to you. So Ivanka, words of encouragement, words of wisdom.
So I think for us, we have to insist that there is no more for us without us. We have to insist on being at the table and not being volunteers at the table to be paid. If the table is being paid, then I need to be paid to be at the table. And so we have to insist that if there is money, and there's a lot of money in this that other organizations are getting, that we cannot say as Black folks that we're willing to give you our free labor. We are not enslaved anymore, and we are not enslaved to these systems. And so we have to insist that there's no more for us without us.
Mhm. Okay, and I'm holding on to that. No more for us without us. I hope everybody's writing that down. Kelly, you got that? No more for us without us. Thank you so much, Ivanka. Those are powerful words. Dr. Lewis, if you're still with us, Dr. Lewis, words of encouragement,
Yes.
words of inspiration.
Definitely, my last word I want to leave all of us is about empowerment. We have to be able to empower ourselves in order to take responsibility for our own health care, our own choices, our own decisions. And the only way for us to make a significant impact on the virus or healthcare in general is that we have to be able to participate. We have to ask for quality healthcare just like everyone else in this country is receiving. We have to want that. We have to empower ourselves, and we just have to go after it and not be afraid of it.
So I got the words here from you, Dr. Lewis: empowerment, go after it, and just go get it.
That's right.
Yep. Okay. Yep. So those are the words. Those are the words. So we were building here, and these are all call to actions. Kelly, I hope you're getting all of it, because when I get to you, Kelly, you're going to be our last person to speak. I'm hoping that you can recite all of those down for us. All right. Thank you so much, Dr. Lewis. Lisa, words of encouragement and that vision for moving forward.
Absolutely. If I can leave one word, mine would be advocacy. We have to advocate for ourselves. And I don't think we, as minority and Black people, we don't do that enough. We will advocate on behalf of our children, on behalf of our loved ones, but you have to advocate for yourselves. Like Ivanka said, move over, make room for me at this table. I have great ideas. I have great knowledge as well. So if I could leave words of nuggets, it would be advocacy. And if you don't know how to do this, find a mentor, find someone that you can find strength in that will lift you up and help you, encourage you to give you the words to advocate for.
Wow. So advocacy, with everything that all three of you said, this could be a whole nother conversation, by the way. It really could be. We could spin this off and have a part 3 just with respect to what you said. So we want to thank you for offering those words of wisdom and those words of encouragement for all of us, not just us listening, but for those who will be listening, because this is being recorded. So others are going to be able to go back and listen to this. And we encourage you to share this with friends and families and colleagues with respect to these conversations that we're having around COVID and dispelling all those myths. I'm going to jump over to Don. And then right after Don, I will jump over to Kelly to round us out. So Don?
Krista, I'm sorry, before you jump to that, I just want to tell you that the session that Dr. James Setta Lewis and others participating on with Artman and Stark Moving Forward group, Ron Ponder and myself, we are moving forward with taking that to the news stations. We are also moving that forward with getting that in the Black magazines and publications. So I just want you to know that.
Lisa, one other question then for you on that. Where is that being played at right now? If folks wanted to tune into that particular footage and they wanted to see that, where could they access that at?
It's actually on the YouTube channel of Altman and of Mercy, of Cleveland Clinic Mercy Hospital as well. So I can push that to you as well, Krista. And I believe you and Kelly both have it, so you can share it. But we want to reach those individuals in the communities that look like us. So we know in order to do that, we have to reach out to those sources that they preview.
Okay. Thank you so much. So we will get that out, and thank you, Lisa, for reminding us about that footage. It is excellent footage. One of the clips, everyone, that you saw very early that Kelly set us up for, that was a clip from that footage. And there were several different questions that were posed in that. Dr. Lewis was on that. I think, Lisa, you were on that, I believe. I know that Ms. Cleo Lucas was on that, and there were several others that were part of that. And so the words that they were saying and the questions that were being posed, just authentic conversations. Again, that could be a part 4 if we had more time and we wanted to continue to move this forward, but that could be part 4 as well. Don, I'm going to come over to you and get your final comments and words of
My final comments would be for people to stand up, take action, make sure that you're not just allowing people to treat you any kind of way, but to make sure that you are standing up not only for yourself, but those who don't have a voice. That is our call, is to stand up for people who don't have a voice in our community so that they can get the services and have the same opportunities as their counterparts. My other call is say something when you know something and help people who can't help themselves. And with that being said, take care of your mental health, your spiritual health, and make sure that you're taking care of you so you can take care of others. Thank you for this opportunity.
Thank you, Don. Thank you so much. And she's so right. That notion of taking care of yourself and putting your own oxygen mask on first is so important, but also standing up and speaking out for others as well. Kelly, I'm going to round it off to you for some final comments and words. I hope you got all of those pieces that everyone was saying, because I was like, I just know you're going to put them all together, and it's great. It's a lot of pressure.
I'm going to try to be as eloquent as they were, but to round it off, or to summarize, today was a great discussion because we had a lot of different points, and I think things that we don't think about on a daily basis, and especially for those that aren't in healthcare. But Ivanka, I mean, she was powerful earlier in sharing what we've experienced from our history and how we can overcome it and how we can think about it. So she said that there is no more for us without us, no more for us without us. We need to be at the table, the policy decision-making tables. We need to be part of the boards and committees. We need to be working, and just our voice needs to be heard. Dr. James Zetta Lewis, you have a wonderful mother. Please tell I said hello. You, physicians such as yourself, because you are the minority, you are under a lot of pressure. And I just know from working from a human resources perspective, when we're looking to do certain activities with African Americans in the community, we would have 4 or 5, and I'm not talking about Canton, but the other systems I work for, we'd have 4 or 5 that we would just abuse everything we needed. We had those same 4 or 5 doctors. And I don't think the community really understands that many physicians and nurses, nurse practitioners, all of those positions are dedicated to caring for our patients, but also they know that they need to advocate for the community as well. So they carry a lot of pressure. And I would just say, to add to what she said, is empowering ourselves and requiring quality health care. Absolutely. And we as a community need to support our physicians and what they do at this and at their systems as well as the community. Lisa, advocate for yourself. Yes. If you go and buy a dress or something and it's not sewn right, are you going to say something? Absolutely. You're going to talk to the seamstress and be like, no, that hem is not where I asked for that dress to be, right? When there is information out there, and maybe it needs to be upgraded or discussed. Health systems can create their own. But when we go to many of us are having parents that are aging and so forth, we won't let them go by themselves. There's a reason for that. When somebody's in the hospital, we won't let them stay without someone being there with them. There's a reason for that. So we have to understand how we can advocate for ourselves and be confident. They're humans just like us. And our bodies are important. There's too much research out there that says we are not receiving the care that we should be receiving unless, in most cases, the physician looks like us. And as Lisa said, if you need to find a mentor to help you to understand what questions should you be asking, what you should be doing, then organizations like the Black Nurses Association, et cetera, they can be there to help. And Dawn, who is, as we can hear, is truly continuing her birthday celebration. She says that you must stand up and take action. It is our call. It is our responsibility to stand up for those who cannot stand up for themselves. And that is absolutely correct. And I just am, and also the information she shared about taking care of ourselves mentally and spiritually. You know, I just read, for those who like Texas Roadhouse, the good old states, the CEO committed suicide Thursday because he couldn't overcome the symptoms and so forth from COVID-19. This was a well-liked man who had a phenomenal way of leading. So his leadership was well respected in the corporate office in Louisville, Kentucky. And you think of a man of that stature and how mentally what this disease did for a white man. So imagine what our folks are dealing with, and especially our Black women. We are just really, unfortunately, we are in a medical crisis right now. We really are. And it's something that we have to come together and address. So I'm just happy that we have this conversation. I'm glad to be a part of it. And I will bring it back to Krista Allison.
All right. Thank you, Ms. Kelly. This has been a great conversation this afternoon going into the evening. We've had 3 levels: understanding our past, what we can do now, and building a healthy future. And with every presenter and conversationalist, it continued to build and build on each other. So we just want to thank everyone, all of our presenters, those that presented, those that asked questions, or those that are viewing this. We want to thank you for joining us for part 2 of this conversation. It was something that has been on our hearts, something that's been much needed. And what we know is that there is empowerment. When we can come together and we can share information and we can look and lean upon each other, there is so much power in that unity. On behalf of the Stark County Alumni Chapter of Delta Sigma Theta Incorporated, we want to thank you for joining us for our part 2 conversation. We ask that, again, you talk with your medical health professional, that you talk with anyone that you can in terms of that health field. If you have further questions regarding the vaccination process, go online to look at the City of Canton and the county health departments. They have all of the dates and times and opportunities listed there as well. And on behalf of our chapter, again, the Stark County Alumni Chapter of Delta Sigma Theta Sorority Incorporated, thank you for joining the conversation tonight. Be well, take care, and be safe. Thank you.
Thank you, Krista.
Thank you, Kelly. Thank you, presenter.
Thank you.
Thank
Bye.
you.
Bye,
Bye.
Dr. Lewis. Bye, Lisa. Bye, Ivanka.
Bye.